Hey, my name is Karn and I am here from New York Sports and Spinal. Wanted to make this video to really give patients an insight of what therapy is. I think most of the time patients do not know or are unsure of what physical therapy is and what they can do. So we have a great volunteer here. This is Eric. He's going to actually tell us, and we're going to go through basically a 5-session course of what we can do for his ailments in this particular instance. Where I think we're talking about your thoracic. He's got shoulder pain. Well, let's figure it out. We're gonna kind of roll. We're gonna freestyle this a little bit. But again, this video is just to give you guys an insight of what, although this is an isolated scenario, this is a great insight of what goes on at a physical therapy evaluation and the treatment side itself too. So let's get right into it. So Eric, why are you here? What are we doing?
Well, I was a long-time practitioner of martial arts, ups and downs, injuries, always kept me on and off of training. So I'm trying to get back into shape and get back into practicing and training. So throughout the course, I've injured my shoulder. One time I just kind of heard it popped. I was in a weird position, did a strengthening. I was trying to work out my back. It just had a sharp pain, like something was pushing out.
Yeah.
Lasted quite a while, then kind of went away, and once in a while it just popped. I get that same pain come in, and it'd be like in the shower, be doing like something really basic and normal.
Got it. And so let's define a couple of things. How long has this been going on for?
It's been a while. So I would say over 10 years.
Okay, 10 years is a long time. What is it holding you back from your shoulder, your left shoulder?
It's just weaker. I haven't been able to make it as strong. I feel like I'm limited to certain positions now. I used to be a little more flexible. Certain positions creates that pain. So and then what I've noticed that I've compensated somehow. So I feel like it actually turns in.
Got it.
Which makes my chest tight and makes it kind of creates back pain and chest pain.
And how does it limit you throughout your day? Does it stop you from anything?
No, I mean I can get around doing normal stuff. It's just you feel the impact really when you're trying to work out and train.
Got it. So you haven't worked out?
No.
Haven't trained?
Haven't been able to.
So our goal in therapy is to get you back into what type of training? Is it weight training?
It's a mix of both. I did a combination of weight training and martial arts.
Okay.
So I like to do both.
Got it. And for me to make sure how to gauge your routine, what type of weight training? Was it barbells? Was it free weights? Was it fill in the blank?
Bit of both. I mean, I did more of like a kind of a CrossFit training. So I did a mix of, using your own body weight, but also doing some actual like barbell and free weights.
Got it. And what have you done prior to coming in here? Have you tried to do something on your own?
I've been to several therapies. Went to a couple PTs. I had some successes, but limited. Some just kind of normal. Like the immediate pain went away. And just kind of like got me through that first part, but it always kind of lingered. I guess nothing was actually improved. Most importantly, I never got something that I can use to prevent, and that's really what I'm looking to.
Got it. And if we started our session after our second session, how would you know you're getting better? What's like the marker of improvement? Because in our world, pain is so subjective, right? So what a 2 out of 10 is to you, a 2 out of 10 is to me differently. How would you know, I guess, how would you assess that you're getting better? Could you mentioned that your shoulder is unstable in the sense that it pops forward, you can't lift. How would you know after 2 sessions that you're headed the right direction?
I guess when I see more range of motion, less tightness, a little, I guess my posture feels a bit different. Okay. So I guess those are quick ways of seeing.
And those are still hard, those are still subjective, so I'm going to try to cue you a little bit better if I can. So throughout the day, is there a pattern for your pain? Is like morning is the worst and gradually gets better? I would
say mornings, since like I mentioned, I get the pain like maybe in the shower or doing some basic regular stuff. So I mean,
what's the regular stuff?
Yeah, like changing, putting something on.
Good. So I want to make sure that we capture a couple of things because when patients come in here, they're someone like himself in this scenario, he's experienced pain for so long that pain is no longer the goal because it's hard for him to see that he's getting better. Now, because we're going to touch him, he might feel like he's getting better, but we don't have anything objective. Everything's been subjective, meaning that it's not really measurable. So yes, range of motion is a PT thing, but we want to make sure that he sees it too. So the dressing, the overhead stuff, it might be combing his hair, blow drying, it might be putting his shirt on. It's the baby steps before we get into the fun, exciting stuff, which is the martial arts stuff, the weightlifting. But before we can at least make sure our techniques are working, we want to know that that marker of just dressing and moving overhead, it's addressed before we add the other stuff. All right. So go ahead and raise your arm as high as you can. Any pain?
I'm actually feeling a little bit on my right.
All right. Come on down. And then back up. No pain.
No pain, just tightness.
Good. Come on down again. Go sideways. Thumbs up. All the way up. Come on back. What do you feel?
It's just very tight. It's like I feel a little popping.
Okay. Got it. Keep on going. Good. Same. And it cracks a little bit. I don't know if you guys catch that. Can you scratch your back? Okay. And let me see the other side. Okay. So actually his good side is more limited, so it's okay. Now let's go ahead and try to scratch your back here. Good. And then the other side. Got it. Okay. Let me see how strong you are. Good. Now hold it, don't let me push down. Good. Any pain?
A little bit.
A little bit. Okay, let's see this side, hold it. Good. Now let's go palms up. Hold it and don't let me push down. Ready? Hold. Good. Same thing here. Okay. So obviously there's a big differentiation here. Right? Now, you're okay? Yeah. Okay. Thumbs up. Hold it, don't let me push. Good. Thumbs down. Hold it. So I just want to clear out his good side because, you know, some people are weak. I don't want to focus on a general weakness because what's normal, it's the good side. So I'm going to do the same thing, hold it. Good. Thumbs down, hold it. So you'll see a couple things, right? What we're doing is we're isolating his rotator cuff. And when I asked him to do that, he automatically shrugged. And it's pretty hard to see in the video, but he shrugs a little bit. So I want to break that pattern a little bit. I also want to know when we see him with his shirt off, does he have any trigger points? But I see a couple of things already. One of the testing we'll do here, hold that arm, right? It's called an empty can test. If we resist him a little bit, you know, he's decently strong. And that's all deltoids. Now we're gonna take away his deltoids. I'm gonna make sure he doesn't shrug here. Don't shrug, yep, hold it. And now don't let me push, right? All right, so there's not much there. I mean, I can just keep on going. I don't wanna irritate you. So let's do a couple more things. Hold that there. Now don't let me push down. Ready, hold it. Good. Great, cool. And then just relax your arm there. Good. Again, let's see. Good, hold it, thumbs down. That was one of the bad ones, hold it. All right, so you can see what happens too once we just at least give him a quick adjustment of the shoulder, he's stronger. So we know, at least on my world, there's nothing so bad with the muscle. Why? Because there was a before and after, really quick, we didn't do anything yet. So we want to see what happens with his, what's going on with that scapulary. All right, so we did some quick assessments on his arm, range of motion stuff. We found out that his range of motion was not so limited, but we want to check out how he is in his scapula. The reason why we're looking at it, your shoulder doesn't work by itself. Actually, some of the muscles here, the scapular muscles, we won't get so technical, has to help out a lot. So we're going to see a couple of muscle strength testing here. Go ahead and put your thumbs up. Now, elbow straight, and then lift up for me. Yeah, hold that. Okay, now don't let me push down. Ready? Hold it. Good. A little higher. Good, one more time, hold it. Good. So he's a little weak there, which most people are. Let me see the other side. So that's why I want to check the good side too. Hold it. Well, this was the bad side, right? That's how we knew. I got a little confused, but you can see that was pretty weak. Let's do it one more time. Hold it. Now, you can see the compensation. He knows what we're supposed to do now. So there's not much there. Let's see it here. A little higher, right? Hold it, right? So that's something we definitely want to address. How's that feel there? Tight. In here. Okay. So what we're doing, we're going to get into the treatment part of it. Again, this is his first session. I don't want to do too much just because all my testing might make him sore. We'll find out. So at this point, less is better. But we do want to start with a couple of things. My game plan for him is I want to do deep tissue. Okay, I want to release some of these knots here. Hopefully you can see some of this, what he has trigger points. But if you can't, it's okay. We're going to basically do a sports massage or a deep tissue to release that sucker. Then we want to make sure that his thoracic spine is moving very well. So you'll see clips of that as far as spinal mobilizations, or what I guess traditionally chiropractors would call manipulation. We don't manipulate, we do mobilizations, which are just a lesser grade of a thrust. All right, so hang in, we'll do a little treat and then we'll get back into the session. So this is the final part of his manual session that I feel is relevant for him. We're doing joint mobilization. We're just allowing his the shoulder capsule to move freely, to also sit in a better place. That way the muscles and the joints could all talk together and allow him to become stronger, move better. Good. All right, go ahead and sit up. So let's just kind of reassess. How you doing with that? What does it feel like to you?
Much better. Nice tight.
Okay. So the natural reaction is just more that if you can trace back or even look back on this video, some of it was apprehension. His face changed, right? He really was hesitating coming down. I asked him to do it a couple of times. The reaction didn't change. This is a little bit more of what are you looking for? And it was a little bit more fluid and free. So we don't want to mess all this up, but what we want to do is pretty much end the session today. Why? Although strengthening for him is super important, we don't want to undo what we did. One, because he might be sore just from me resisting him and doing all that testing. So less is better. I want feedback from him. I'm going to expect that he should be sore, but never sore for more than 2 days. We'll make our adjustments based on that as well too. But let's go look at a couple of things too, because if you guys remember that test, the empty can test or that shoulder test, let's take a look at it here too. So if you remember, the thumbs up was pretty good, but the thumb down was pretty weak. He's not shrugging. I didn't cue him. It's hard to see that one too, but hold it. Now let me push. Okay. All right, so you can see I'm really pushing, or hope you can see. Good. And then you're okay. Hold it. All right, so again, if you can see, the strength is good. So this is a young, healthy patient who hasn't been back to his craft, his sport, his sanity in 10 years, and we're exaggerating a little bit, but that's the reason why, because he's trying to do everything on his own. But the good part is when you start addressing things, you really find out that things are not as serious as you might think it is. So a couple of tweaks for him, where just to restore some muscle imbalances. Don't get me wrong, this is not the end of it, but it's a start. It's a start to find out that his dysfunction is not serious. It should have been addressed earlier, could have been addressed earlier. And number two is that he's really a couple of weeks away from really training. And what we want to do is add that into our sessions to make sure he doesn't leave us pain-free and then goes into his sessions. All right, so thanks. Check out the next video. We're going to get into a little bit more of the full treatment sessions where we add the exercises as well too. All right, thanks.
My first session went absolutely better than I expected. Got a really good assessment of what's going on, what can be the contributing factors of what my shoulders issue are. I really feel like I really took in consideration from the small things to the larger goals that I want to accomplish, and that it actually has a thoughtful plan for me to get there.